Hello folks, and welcome to chapter 22 of this week's lesson. Today we're going to be talking about the medical assistant's role in coaching and educating their patients. And as always, to follow the objections, one, we're going to describe the medical assistant's role as a coach or a healthcare coach, list and describe stages of grief, and also discuss health belief models to help to explain what factors influence a person's health beliefs and practices. We're going to describe the three domains of learning, which I think we might have touched upon on first week of class, but we'll go more into that this week. Explain how a medical assistant can adapt their coaching to the patient. Describe the teaching learning process, not only for your patients, but for yourselves as well. Discuss how a medical assistant can coach a patient on disease prevention. Number 7, describe how a medical assistant can coach on health maintenance and wellness, including different types of self-exams and screenings. Number 8, describe how a medical assistant can coach on diagnostic procedures and treatment plans. And finally, describe care coordination and patient navigation to develop a list of community resources and facilitate referrals. So coaching provides the patients with skills, knowledge, support, and confidence to manage their disease between provider visits. One study found that coaching by medical assistants increased the patient's compliance with medication regimens and lifestyle changes. Coaching is extremely valuable for patients. The medical assistant can coach patients in many areas, including the following: disease prevention, providing patients with information on preventing disease and spread of disease. Medical assistants can provide information on hygiene practices, recommended vaccinations, smoking cessation. Health maintenance, providing patients with information on routine screenings and show patients how to do self-exams such as breast exams, oral exams, testicular exams. Coaching on diagnostic tests, instructing patients prior to the diagnostic test. This includes special preparations such as fasting or bowel cleansing preparations. Treatment plans, instructing patients on home care and follow-up as ordered by the provider. Research has shown that coaching can help patients understand information from the visit. It can ensure patients understand how they need to proceed and address any concerns before they leave the facility. Looking at the specific needs, patients have unique concerns. They can include personal, family, social, financial, and culture-related issues. By listening and asking questions, the medical assistant can help address their specific needs. By closely working with the patient, the medical assistant can provide emotional support and create a bond with the patient. This bond can help that patient feel much more comfortable. And then finally, by involving community resources, listening to patients and asking questions, the medical assistant can identify a patient's unique needs. Patients may have many needs that affect their health. For instance, if a patient has limited income, does the patient purchase the prescribed medication, or do they choose between food or rent instead? There are community resources that exist to address the many needs, including low-cost medication, food banks, transportation services, medical supplies, assisted living, and so on. So this chapter is going to provide information on specific aspects of patient education required for these coaching areas. But first, let's examine some health beliefs and practices and how to adapt education and patients' needs. Elizabeth Kubler-Ross was very famous for her studies on people's reactions to death and dying. She found that people experience similar stages. Over the years, these stages have been applied to grief and loss. When a patient and a family get a life-threatening or life-changing diagnosis, they can feel grief and loss. People go through the stages of grief in their own way and at their own pace, and sometimes all at the same time. This process can take weeks to months. The patient may not be open to making the recommended changes. Healthcare professionals may view this as a patient not wanting to comply with the treatment plan. Sometimes a patient has to accept a diagnosis before compliance occurs. It's important for the medical assistant to adapt to these interactions and help with the stages of grief and also to recognize them. First stage would be denial. The patient refuses to accept the fact or the diagnosis or the prognosis. They may refuse to discuss the diagnosis. They may not remember the health coaching. Denial is a defense mechanism that allows a person to ignore what is happening. The next stage would be anger. This anger can be directed at self or others, or maybe what they believe is a higher being. Anger can surface at unrelated times. It can be directed towards unrelated issues and towards unrelated people, like yourself. Bargaining. Some attempts to bargain with the higher power the person believes in, like their God. Sometimes the patient will bargain with the provider to make lifestyle changes at a later time. People will often go through depression and feel sadness, fear, uncertainty. They may grieve the loss of their health or independence, and they may dread the change that's occurring. And then finally there comes acceptance, where they finally come to terms with the situation. So the health belief model helps explain what factors influence a person's health beliefs and practices. The first part of this model deals with a person's perception of his or her chance of developing a disease. Some examples include the following. Say you have a young lady in her 20s and just lost her mother, sister, grandmother, all to breast cancer. She feels her chance of developing breast cancer is significant. I have another individual who has an older brother with heart disease that's being managed by medication, diet, and exercise. This person blames the disease on his brother's stressful job. This person doesn't have a stressful job, so feels he won't get heart disease. Even though he receives education on heart-healthy lifestyles, he ignores the information. The second part of this model deals with the person's perception of the severity of disease. A person's perception is influenced by the following factors. Personal factors such as age, gender, race, employment. Social factors such as peers, personality, family, perceived threats of the disease, and cues to action. For example, mass media campaigns, social media, advice from family, friends, healthcare providers, and professionals. The third part of the model focuses on whether the person will take preventive action. The person usually weighs the benefits of and barriers to taking the preventive actions. For example, one may decide to have a double mastectomy as a preventive strategy. For many, it may seem severe, but if this person who has a overwhelming family history is willing to take such preventive action. Because a medical assistant coaches patients on preventive action, it's important to remember the model. Start with identifying if the person perceives he or she is sick for the disease. Exploring the patient's belief and educating the patient on the facts, in addition to getting rid of the myths, can be helpful. So when it comes to coaching patients on healthy lifestyle choices and medical diagnoses and follow-up, it's important to have an understanding of what we call domains of learning. Learning is the process of gaining new knowledge or skills through instruction, experience, or study. We learn new information in 3 different ways, or what we call domains: cognitive, psychomotor, and affective. The cognitive domain involves mental process of recall, application, and evaluation. We learn new information by listening to what is said and by reading written words, and then integrating that material. Many experts believe that we have 3 ways to store memories. First is the sensory stage, which is constantly picking up perceptions through sight, sound, touch. Then there's short-term memory. This is our temporary working memory. If nothing's done with this memory, it'll fade within about 30 seconds. Short-term memory can only handle about 6 or 7 chunks of information at once. By chunking this information into meaningful units or attaching to something we already know, we can increase the amount in our short-term memory. And then there's long-term memory. The more we use short-term memories, the quicker they enter our long-term memory and become permanent part of our being, so to speak. We can add endless memories to our long-term memory, but without use or recall, those memories can fade. Our goal for patient education is to put the information into patients' long-term memory. Not everything we tell the patient will be picked up and remembered. We hope the information will be, but that comes with practice and motivation on the patient's part. And the psychomotor domain is the doing part, the hands-on, the skills. We learn new skills and procedures by watching demonstrations and assisting with something and with practicing. Many people would prefer to attempt a skill versus reading about it or discussing it. They learn best through the psychomotor domain. Some um, some barriers to the psychodomain. Some tips to help patients remember critical information through the psychomotor domain is to 1. Provide written step-by-step directions for the patient to follow and take home. Give timely feedback on the person's performance. Have the patient teach back the skill to check for accuracy. Repeated practice doing the skills helps with recall and retention of the steps. Make sure to use the equipment and supplies the patient will be bringing home. And finally, there's the affective domain. It's the feeling domain. It includes our feelings, emotions, values, and attitudes. Our emotions and values are very important. They affect our motivation, confidence, and priorities. When our personal values conflict with new information presented, a barrier to learning can occur. Pain is another example of an affective barrier. If you're instructing a patient on wound care and he's in pain, you may not remember what you said. As we grow and develop, our thought processes and behaviors change. We learn differently. We can understand more complex concepts than when we were younger. It's important for the medical assistant to consider the person's developmental level when coaching. For instance, young children are concrete thinkers. What you say is what they believe you will do. For example, if you say, "I'm going to take your blood pressure," a 2-year-old child would have no idea what you're going to do. If you say, "I'm going to give your arm a hug," then the child may have a better understanding of what you're going to do. Coaching techniques you use for teens will be different than those you use for older adults. Also, referencing materials as you talk can be very helpful for patients. Erickson's psychosocial developmental stages can be used when considering the development level of patients. Understanding the goals of each stage can help a medical assistant to coach patients in that age group. So first we have trust versus mistrust. This usually ranges from age 0 to about 1.5 years old, or in infancy. And the goal of this stage is to develop trust with the ability to mistrust should the need arise. Then there is autonomy versus shame and doubt. Age range about 1.5 to 3 years. The goal of this stage is that we must explore and manipulate things in the world to develop autonomy and self-esteem. The medical assistant can help with that by using simple, familiar words, allow child to handle equipment and make choices, use play to teach the child. Next stage would be initiative versus guilt. Age range is 3 to 6 years old, or preschool. Goal of the stage is to encourage to try new activities. Child must assume responsibilities and learn new skills. Will make the child feel purposeful and increase self-esteem. The coaching tip for the medical assistant would be to use familiar words and simple explanations and demonstrations. Allow the child to handle equipment and make choices. Explain the procedure as the child would sense it, how it feels, how it looks. Next stage would be industry versus inferiority. Age ranges 6 to 12 years old, or school-age children. The child must seek to finish tasks. Recognition for accomplishment is important. The MA can help out by using engaging, simple tools to communicate information, such as videos, gaming, software, pamphlets. Encourage discussions and questions in making choices. Next stage is identity versus role confusion from ages 12 to 18, or adolescence. Goal is to know whom you are as a person and how to fit into the world around you. Create meaningful self-image. The medical assistant's role here would be to help provide privacy and independence. Encourage responsible decision making. Encourage discussion and questions. Address how a procedure might affect the adolescent's appearance. Next stage would be intimacy versus isolation. This is the young adult range from about 18 to 25. Goals can vary. This is a time when friendships take on commitments. Medical assistant can help by identifying motivating factors. Find out what they know about the topic. Correct any inaccuracies. Build on prior information and listen to their concerns and provide resources as needed. In the next stage, from the age range of about 25 to 60-year-olds, you have generativity versus stagnation. The goal is to achieve a balance between the concern for the next generation and being self-absorbed. In the age range in 60 years and older, a period of life we call senescence and elderly, you have ego integrity versus despair. This is when the patient reflects on one's life and comes to terms with it instead of regretting the past. Your medical assistant can assist with that by communicating with dignity and respect, using simple language, speak clearly, allow time to respond, build on what they know about the topic, correct any inaccuracies, and build on prior information. I'm sure we've all heard about the importance of cultural diversity. Culture is a set of behaviors, ideas, and customs shared by a specific group of people, which distinguishes the members from other people. Some characteristics of a culture group may include its language, religious beliefs, geographic origin, ethnicity, history, sexual orientation, and socioeconomic class. Culture can be learned from prior generations and passed on to future generations. It's always dynamic and evolving. Our culture frames and shapes how we feel about our health and the world around us. There are some factors affected by a person's culture that healthcare professionals should consider, and these include the following. 1. The role of the family and community. Who makes the healthcare decisions? Who pays for the healthcare? Who needs to be present during the healthcare discussions? Religion. What are the beliefs about illness? Will the person's religious beliefs affect adherence to treatment? Very good example would be the Jehovah's Witness religion, who absolutely forbids the use of any type of blood transfusions in the treatment of any illness. So healthcare providers need to find ways to work around that. What are the person's views on health, wellness, death, and dying? Views on complementary therapies such as chiropractic care, massage, acupuncture, and other alternative therapies. Views on gender's roles and relationships. Beliefs related to food, diet, illness, and health. And also the beliefs regarding sexuality, fertility, and childbirth. In the United States, disease conditions are seen more of a scientific situation. Science plays a major role in medicine. Many other cultures, however, take a more holistic approach. A holistic view focuses on the interrelationship between the physical, mental, social, and spiritual aspects of a person's life. A holistic approach is broader than a scientific approach to health and illnesses. Now, coaching patients with communication barriers can be a challenging process. Hearing, vision, and language barriers are common in healthcare. It's estimated about 2% of people in the United States have a visual impairment, 3% have a hearing impairment, and at least 9% have limited English proficiency. It's important to overcome these barriers when coaching patients. For healthcare agencies accepting federal funds, the Civil Rights Act requires that all patients have equal access to services. People with vision, hearing, or speech impairments use different ways to communicate. The Americans with Disability Act requires effective communication with patients who have impairments. This may mean offering a qualified medical interpreter or other interpretation services free of charge. Large print materials and written instructions are also required. Translated written materials are needed for non-English speaking patients. The following topics provide tips for communicating with patients. So let's talk about patients who have impaired vision. When working with patients who have impaired vision, it's important to ensure the room has adequate light. Position the patient so she or he does not have to look directly towards the light source. Make sure the patient is wearing their contacts or glasses if needed. For patients who have impaired hearing, following are important. Face the person when speaking. Determine if that person has better hearing in one ear than the other. Position yourself so your voice is close to that side. Encourage them to use their hearing aid if they have it. Do not yell or holler at the patient because it'll only make your voice sound more blurry. Use a low-pitched voice and speak clearly, slowly, and distinctly. Pause between sentences and phrases. Patients who have language barriers. So when teaching a patient who has a language barrier, the following are important. Address the patient by his or her last name, being respectful and courteous, not to come off as condescending. Use simple phrases. If medical terminology must be used, make sure to define it for the patients. Use an interpreter or interpretation services. It's very easy these days with technology. Focus on the patient and not the interpreter. Use translated materials for follow-up educational purposes. Pictures and models can also be helpful during the coaching session as well. So teaching opportunities vary greatly in ambulatory care, and they can play a great role in establishing a relationship and rapport with the patient and the healthcare facility. Sometimes a patient wants to know what a certain medication is for. Other times, a medical assistant needs to coach a patient on a diagnostic test. Always take a moment to look over any information you provide to patients. Make sure you know the content before you review it with the patient. Providing information that conflicts with the handout will confuse the patient and make your credibility less so. Coaching sessions will be lengthy because more complex topics are being taught. Coaching sessions should be well planned and time used efficiently. Some following steps in the coaching session include the following. Assess the learning needs. What does the patient need to learn? How ready is the patient in their learning? What are the patient's motivations and concerns? What is their learning style, and what are some of the barriers to learning? Determining the patient's priorities. It's important to prioritize what the patient needs to learn first. When there's a lot of content to learn, the medical assistant must prioritize the most important topics and address those. Planning the teaching process. When planning, determine what teaching aids and strategies will be used. The teaching strategies and aids used must be appropriate for the content being taught. For instance, demonstrating how to give an injection and having the patient give a return demonstration will be more useful than just discussing the steps of giving the injection. Implementing the teaching process. It's important to start with the basics and build from there. Keep the information simple, focused, and appropriate for the individual patient. Reinforce important information. Evaluate the patient's learning. After teaching important points, have the patient summarize what you stated. Keep the patient involved will help him or her retain the information. And then finally, documenting the teaching learning process. It's important to document, just like anything else, the content taught to the patient, how the patient responded, evidence the patient learned the content, handouts given, and any plans for follow-up. Make sure to include the provider's name and any adaptations you made to individualize the teaching learning experience. Again, medical assistants are usually very good at coaching patients of all ages on disease prevention. It's important to help patients understand ways to prevent diseases in their lives. Common disease prevention coaching by age groups includes the following. With school-age children, teaching about hand washing and cough etiquette, in other words, coughing into their elbow instead of their hand or more so in somebody's face. Talking to teens and adults, teaching about ways to prevent sexually transmitted infections or STIs and the risk of using cigarettes, smokeless tobacco, e-cigarettes. All age groups, including parents, should be coached on vaccines and recommendations for that specific age group. Childhood immunization schedules can be found on the website cdc.org. And this includes things like yearly influenza, tetanus and diphtheria, shingles vaccine for your older generation, of course, COVID vaccinations, which probably isn't listed in your textbook at the time of publication, and additional vaccines based on situations like hepatitis B, HPV vaccine, and others. Often with health maintenance and wellness, the provider establishes standing orders for specific education to be given based on the patient's history or age. When a medical assistant rooms a patient, a healthy history is obtained and screening questions are asked. Based on the patient's answers, the medical assistant may need to provide coaching on specific topics as per the provider's standing orders. For instance, a patient states she smokes 1 pack of cigarettes a day. The provider's standing orders for smokers requires the medical assistant to provide information on the hazards of tobacco and the resources for quitting. Another example would be a patient who's turning 45. Because colon cancer screenings typically start at age 45, the provider's standing order would be to provide information to this patient. The following sections discuss self-exams that can be taught to patients and the screenings that are commonly done. The medical assistant completes some screenings, whereas others require the medical assistant to educate the patients on the tests to be performed. The purpose of self-exams is to identify changes in one's body. Sometimes these changes can be the first sign of disease and can be discovered with self-exams before any symptoms manifest. Self-exams are typically done monthly. To help maintain a person's health, the earlier the diagnosis of a disease of cancer usually involves a better outcome. So for example, breast self-exams are recommended every month. Yearly mammograms recommendations start between the ages of 45 and 50. Now, these are general guidelines based on a patient's family history and risk factors. The guidelines may change a little bit based on that individual's needs. Testicular self-exam in young males should be encouraged. According to the American Cancer Society, males at any age can develop testicular cancer. But most commonly is in early adulthood, usually between 20 and 34 years of age. If cancer is found early before it spreads, there's a good chance of cure. Skin cancer is the most common type of cancer in the United States. The 3 most common types of skin cancer are basal cell, squamous cell, carcinomas, and melanoma. Certain people have more risk than others for skin cancers. Experts recommend monthly skin self-exams, and it's important to watch for changes in moles and lesions. This will be discussed more specifically when we discuss dermatology. Oral cancer self-exams. Oral cancer includes cancer of the lips, tongue, throat, salivary glands, pharynx, larynx, and sinuses. Most oral cancers occur after the age of 40 and are usually highly associated with tobacco use. Medical assistants in primary care typically need to talk with patients about recommended regular screenings for different diseases. Suggested times for screenings are based on an adult with average risk. If a patient has family members with disease, that person may have a higher than normal risk. That means a patient may need to be screened earlier and more often than adults. Usually the guidelines of intervals between tests and how often tests should be performed and at what ages the test should be performed are constantly being updated and changed. So we're not going to hold you to memorizing when a patient should receive a certain test, but rather we're just going to go over what each test entails, a little bit about it. So blood pressure, for example. Patients at higher risk include African Americans, people who are overweight, and those with previously documented higher than normal blood pressure readings. Bone density screenings are a little bit controversial. This screening provides information on the strength of the patient's bones and if the patient has osteoporosis, which may lead to a greater risk of what we call occult fractures, or fractures that occur without any incidence of trauma. Women have a higher risk than men and increase with age. A cholesterol screening should probably be performed at every annual visit. Adults with a family history of high cholesterol levels or who have high cholesterol need more frequent testing. The American Cancer Society recommends that regular screening for colorectal cancer begins at age 45. Screening can either be based on stool samples that are brought into the office or a colonoscopy, which involves direct visualization of the internal structures of the colon through a specialist, a gastroenterologist. And that involves a lot of prep and education. The American Dentalist Association recommends a dental exam and yearly cleaning. Dental health is very important to affect the overall health of the body. It's important to have a dilated eye exam if a person has risks of eye disease, and also for patients with diabetes, African Americans over 40 years old, patients with hypertension, and a family history of glaucoma as well. Patients who are 55 to 80 years old have a history of heavy smoking, and are currently smoking or quit in the previous 15 years should be screened for lung cancer. Mammograms are also being met with a little bit of controversy. This is basically an x-ray of the breast to help identify breast cancer. The American Cancer Society so far recommends that women ages 40 to 44 have the option to have annual mammograms. Women ages 45 to 54 should have annual mammograms, and those 55 years older should have a mammogram at least every 2 years. Pap test is used to identify cervical cancer. And prostate cancer is the second leading incident of cancer in males over 50. Risk factors include being 50 years older, African American, exposure to Agent Orange back from Vietnam, or having a first degree family member, such as a father or brother who had prostate cancer. Blood glucose testing should be performed generally at every annual physical, and more frequently for people who have a history of type 1 or type 2 diabetes. The medical assistant may also need to coach patients on one-time screening as indicated by the provider. People are recommended to have the following screenings at least once unless a person's risk is greater than average. Abdominal aortic aneurysm. Males between 65 and 70 years of age who have smoked at one time in their lives should receive the screening. This population is the highest risk for having what's called a AAA or abdominal aneurysm, where there's a weakening of the wall of the aorta in the abdominal cavity. HIV screening, blood test. People 15 to 65 years old need to get an HIV test at least once in their lifetime. All pregnant women need to be tested. People with high risk for HIV should be tested annually, if not more often. High risk factors include multiple sexual partners who have or may have HIV, and those who use injectable drugs. Hepatitis C is a condition that's passed through the blood from an infected person. A person with risk factors should be tested. Risk factors for hepatitis C include the following: born between 1945 and 1965 when blood transfusions were not screened appropriately. History of blood transfusion or organ transplant before 1992. Use of injected illegal drugs. Chronic liver disease. History of HIV or AIDS as well. When rooming patients, medical assistants have to perform different screenings. Either the patient's age or the patient's response will trigger the need for the screening. Screenings have increased throughout the years. This is due to increased data collection requirements and focusing on prevention and quality care. Common screenings include the following: use of alcohol misuse. Drinking in moderation means that females have no more than one drink and males have no more than 2 drinks per day. Nicotine and tobacco screening. Various tools are used, whether nicotine products are used, how much, and over what course of time. Drug abuse screening. Various tools are used and focus on prescription drugs for non-medicinal uses and illegal drug use as well. Intimate partner violence screening. This is something that's quite often overlooked. The screening covers domestic abuse, whether it's male on male, male on female, female on female, or female on male, or a combination of any of the above. It is important to remember that both males and females can be victims of domestic abuse. Many psychological and health problems come from violence, including substance abuse, obesity, depression, brain trauma, pregnancy complications, and chronic pain. Elderly safety screening is important. These screening tools focus on how safe an older person feels at home. The tools screen for abuse and neglect as well. Functional status screening. Several tools are available for primary care providers to use for older patients. By using functional status screening tool, the provider obtains information on the patient such as their physical function with daily activities, their psychological health, their role function, whether they're employed or volunteer, and their social function, their ability to interact with others. Depression screening. Several tools are used to screen for depression. Screening tools ask questions related to moods, thoughts, and feelings. Peripheral neuropathy screening. Screening questions focus on loss of feelings or pins and needles sensation in the feet and hands, which can be associated with things like diabetes and other neurological problems as well. It is important for the medical assistant to provide the necessary teaching for diagnostic and laboratory tests ordered for the patients. For tests to be completed, the patient needs to be prepared. Some tests require fasting, where others do not. The medical assistant needs to provide answers to these questions. Well, what is the test? Where does the patient need to go for the test? When is the test being scheduled? Does this test require fasting? If so, for how long? If no food or beverages can be consumed, does this include water? Should patients continue to stop taking their medications? This also may require a discussion with the provider. Many facilities have the medical assistants meet with the patients after the providers finish. The medical assistants review the treatment plan with the patients. They answer any questions, explore any issues the patients may have, and provide additional instructions. As mentioned, this type of coaching has been shown to increase patients' compliance with the treatment plans. Additionally, it provides patients with a lifeline, should they have any questions or concerns at home. Medical assistants coach patients on treatments to do at home. This could include taking medications, caring for casts and splints, applying hot or cold therapy, and using assistive devices. Besides these treatments, the medical assistant may also need to help coordinate the patient's care for additional treatments such as physical, occupational, or massage therapy. We've previously mentioned the role of the medical assistant as a care coordinator. Care coordination provides personalized patient and family-centered care in a team-based environment. Advantages of care coordination include the following: greater efficiency with providing patient care, reduced costs, greater patient care, individualized patient guidance and services, encouraging patients to focus on goals and self-management, reducing hospital emergency department visits and readmissions, ensuring the patient's needs and preferences for healthcare services are met. The care coordinator communicates between the patient and the healthcare team. Care coordinators ensure patients get timely care and do not fall through the cracks. In the ambulatory care setting, care coordination can be set up in different ways. It's been shown to be very successful in primary and specialty care areas. Overall goals of care coordinating include helping patients understand why and what services are needed, scheduling and sequencing appointments, providing instructions and directions to patients, ensuring the test results are available to the providers during patient appointments, and communicating the patient's needs and concerns to them. A patient navigator, also called the patient advocate, has been described as a type of care coordinator. The Navigator program was established at Harlem Hospital in 1990. The goal was to assist cancer patients in accessing quality health care. Based on the success of patient navigators, the Patient Navigator Outreach and Chronic Disease Prevention Act of 2005 funded additional positions. Today, patient navigators typically guide chronically ill patients through the healthcare system. They identify patients' financial, cultural, physical, and emotional barriers. Then they work closely with the healthcare team and the patient to ensure barriers are eliminated and the patients get timely care. In the ambulatory care setting, the medical assistants can be care coordinators. A person must have a strong interpersonal skills to be successful as a care coordinator. The medical assistant must listen to the patient and the family to identify their needs and concerns. The coordinator must be compassionate, yet provide firm guidance with patients who are difficult. With the advance in technology, patient education materials are no longer available just on paper. Apps can help provide explained procedures and diseases to patients. YouTube links and other websites provide videos and information on diseases, procedures, and treatments. It's important to vet and screen these type of sources to make sure the information is up to date and accurate. When you use patient education materials from apps and online sites, it's important to use only provider-approved sites. After coaching a patient on a topic, it's important for the medical assistant to document the teaching. The medical assistant should indicate what the provider ordered for coaching, material used, and general topics taught. The medical assistant should also document an evaluation statement regarding the learning. Evaluating a patient's learning can be done through several methods, including asking the patient questions regarding the content or having the patient teach back the skill or content. The purpose of the evaluation is to determine if the patient accurately understood the information or skill. The evaluation method and the patient response should be documented in the medical record for legal purposes. Just by the design, care coordination helps provide patients with individual assistance, patients who feel well cared for and who feel comfortable talking with their healthcare team stay with the provider. It's estimated that care coordination will increase in popularity in the coming years. This model of care will also promote exceptional customer service in the healthcare industry. And with that, if there are any questions, please bring them to class. Please post them on the discussion board or email me personally. And with that, also have a great week and study hard. We will pick up next week.